In today's Health Watch, more than 7 million Americans are living with Alzheimer's disease, and a diagnosis can be devastating for patients and their families. But hope could be on the horizon. New scientific breakthroughs in detection and treatment show the potential to slow the decline if it is caught early. This is so exciting. Our chief medical correspondent, Dr. Jon LaPook, is here with what you need to know. But first, here's a look at one family's experience.
Oh my, Marty.
Carla and Marty Miner have traveled the world together, married 44 years.
Look how young you look there.
They recently visited Bhutan.
We have a great time together.
3 years ago, Marty noticed Carla occasionally repeated what she'd already told him.
I didn't know if it was stuff that's happening because we're getting older.
A neurologist diagnosed Carla with Alzheimer's.
It was horrible. You know, I'm not going to have that. I don't want that.
Some patients and physicians have been reluctant to diagnose Alzheimer's because there have been few treatment options.
Are things different now because there finally is a medication that could potentially make a difference?
There's finally a medicine that you can show is different from placebo.
Dr. Sam Gandy, a professor of neurology at Mount Sinai School of Medicine, offered Carla a drug called Leqembi. It's an intravenous infusion of one of 2 drugs approved within the last 3 years to treat the disease. It removes plaques in the brain called amyloid, a protein associated with Alzheimer's.
So the red blobs are where the amyloid is.
Dr. Gandy has done consulting for the company that makes Leqembi. In patients with the early stages of Alzheimer's, studies showed the drug slowed mental decline by about 30% after about 18 months. Both treatments carry FDA black box warnings on the risk of swelling and bleeding in the brain.
Occasionally, there will be some swelling, in some cases to the point maybe of even some bleeding. So we do surveillance MRIs, regardless of whether there are symptoms or not.
How does that feel?
Carla Miner has had 7 infusions over 5 months. It's too soon to tell if the treatment is working, but she's currently independent, enjoying time with her husband, and still able to channel her favorite singer.
I know all the lyrics to a lot of those old rock and roll songs that I used to listen to.
You ain't nothing but a...
Hound dog.
All right.
I'm hopeful. I have a wonderful life. We've just been very, very lucky. Hopefully, this will be lucky too.
I love that, John. That's so good. Dr. LaPook, good morning. Good to see you. So this sounds like for the first time that there is hope for people suffering from this.
Finally,
Yeah.
right? For years, people didn't even know. I'm an internist, as you know. My patients, everybody's frightened of Alzheimer's.
Yeah.
But do you want to know? What can you do? Now, finally, if you diagnose it early enough, it looks like there's something you can do. In these studies, you could slow the rate of decline by about 30% at 18 months. And I'm telling you, I just got off the phone here for CBS Mornings Plus, CBS Mornings Plus, exclusive with Dr. Sam Gandy, fresh from the meetings in Toronto, and he told me that the longer data from not only at 18 months, but 36 months and even longer showed just as good, in fact, maybe even better result. And there's something else that they're doing, which they're finally able to diagnose this using a blood test.
That was going to be my question, because a lot of people don't know what's happening until it's almost too late. So is this going to be a regular practice to test people's blood for this?
Well,
at a
so
certain age?
millions of questions, who's at high risk?
Yeah.
Who do you test? Are there false positives? Are there false negatives? How, is it covered? All that kind of stuff. But basically where they're going is that, look, it looks like the earlier that you make a diagnosis of this, the better chance you have to intervene. The changes in your brain begin 10, 20, 30 years before you may have symptoms, right?
Whoa,
and
don't say that.
Well, what Dr. Gandy told me is that what we're headed towards is a series of cocktails. So you're seeing them go after an abnormal protein called amyloid. That's a gooey thing that covers the nerve cells. There's another protein called tau, T-A-U, that's inside the cells. There's also inflammation that goes on. And I think what we're going to see in the future is a cocktail, not just one approach, of something that attacks tau, something that gets rid of amyloid, and something that it decreases inflammation in the brain. And how do you do that? Aspirin doesn't get past the blood-brain barrier, so new medications that can do that. I'm very hopeful for the first time in like 19 years of covering.
That is very, very cool. Dr. Jon LaPook, with that great news. Yeah, thank you very much.
And the disease that's affected so many people.
Yeah, everybody in our families, of course.